I was dizzy for 3 weeks, and I was nauseous for 3 weeks. As a retired nurse, I did suspect something other than just being dizzy and nauseous because it had gone on for too long. But you want to kind of overlook those things, so you think it'll go away. Well, it did go away, but not like I thought it would go away.
So they did a CAT scan of her brain, and they found out that she had a tumor there. It was in the cerebellum, the very lowest back part of the brain. It's an area that's somewhat less accessible than other parts of the brain are, but an area that's safe to do surgery on and take a tumor out of.
I remember going into the ER, and everything was kind of a daze, and I remember Dr. Anderson saying, "You have a brain tumor." And I said, "Okay, let's get it out."
We made sure that she was safe to undergo a fairly large brain surgery. Then we went ahead and took her to the OR at that point, and so it was within a couple of days, which is a pretty rapid timeline for somebody from initial presentation to a diagnosis and to getting treatment started.
I guess tumor, cancer were words and situations that were certainly not in the back of my mind at that time. So when I arrived at the emergency room and the doctor came out and announced that she had a tumor and that she had cancer, and and showed us the X-rays and the CAT scan and all that, it really caught me off guard. I think we've been partners a long time, and so we just knew that this was one more challenge that we were going to have to share.
Most of the time, tumors in the brain come from some other cell in the body. There are some suspicious spots on her lungs, and that made us worry that she probably had a lung cancer.
She's now taking chemotherapy for her cancer that we found in her lung. We have additional radiation treatments that she's going to be going through, and then we're hopeful that she can have a surgery to possibly take out the cancer we found in her lung.
I thought it was amazing that, I didn't have to travel to Lincoln or to Omaha, and I could get everything I needed at St. Francis. From the time I went into ER until I left, I had absolutely nothing but excellent care.
It's tremendous. I don't know how you put that in words, how reassuring that is to know that you can have that kind of expertise and caring without having to travel to Lincoln, Omaha. That is right here within an hour and a half of your home.
From a nurse's perspective, the quality of care at St. Francis was excellent. Even though, they know what you do for a living, it did not stop them from doing their job or from explaining every last detail of everything. And that really makes you feel comfortable.
I was unfamiliar with the environment and the setting, and I obviously must have looked lost. And there was this lady who was a custodian, and she just stopped and asked what it was that I was looking for and where I needed to go. And she just laid down her equipment, her mop, and she says, "I'll just walk you up to the elevators." And I was very impressed with that, that sense of caring and courtesy. And I started watching, to see if that was consistent, throughout the organization, and I found that it was. And so I was very much impressed with that culture.
Well, I got the okay from both Dr. Raymakers, my oncologist, and Dr. Anderson, and I did the Lincoln Half Marathon. And I was 9 minutes slower than I was last year, but I did it all the way through. I had my tumor removed on April 9th, and the marathon was May 6th. So it wasn't even a month.
Rhonda is very competitive. She likes a challenge. And I think to some degree she did that just to prove to herself that she could, and she wasn't going to let this medical situation hold her back or down.
Well, we do like to camp. When we take our sports car, we use the tent, and we basically, every fall, we kind of take a vacation. and we go camping. When we can, we head back to Omaha to see the grandkids.
We rarely ever spend, 2 nights in the same place. We're just kind of like gypsies, once we get a chance to hit the road. And it's the exploration.
It has been a journey. There is an end to it, but it's a positive end. It's just that everything will disappear because you have to have a positive attitude. My journey, my hospital.
Neurosurgery at St. Francis Medical Center. Well beyond healthcare.